My name is Faith, and I'm a patient of Dr. Haddock. I was diagnosed with BRCA1 after finding out that my mom had ovarian cancer. And I went to see a breast specialist, Dr. Julie Broadwell, and she recommended Dr. Haddock for the DIEP flap procedure. And that's how I ended up reaching out to Dr. Haddock. We had a consultation. He explained the procedure, what my risks were, and I was able to go online and see before and after pictures of the results. And I think ultimately that's what made my decision to choose Dr. Haddock. Dr. Haddock, like I said, the reviews, the before and after pictures, that really made my mind. That changed my mind. So, yeah. So I'm from Shreveport, Louisiana, and Dr. Haddock is in Dallas, Texas. It's about a 3.5 hour drive. So I felt like if I need to come see him for an appointment or anything, I can just get on the interstate and drive. It's not that big of a deal. So it was a little difficult because I have, at the time, a 4-year-old child. She has autism, and I'm never away from her. So that was hard. However, the whole reason of me having this procedure is that I could be there for her. So I could try to prevent the same thing that my mom is going through to make sure that I'm there for her. I was in the hospital for maybe about 2 days. So it was difficult. The recovery, however, right after surgery, I was able to just go home. So it wasn't that hard. Yeah, it's not that bad. So get on Interstate 20 and just come on out. So it's really not bad. Yeah. So I had a DIEP flap procedure. It was a bilateral mastectomy with immediate reconstruction, where they took the tissue from my abdominal area and put it in my breast. And everything looks good to me. I was really happy and pleased with the results. So, yeah. He partnered with Dr. Deborah Farr here at UT Southwest, and she completed my mastectomy, and Dr. Haddock went in behind her to do the DIEP flap, the immediate reconstruction. It was robotic, and the healing time was really fast. It was, amazing, So, yeah. Do your research. Do your research, go and meet with the doctors, the physicians, the surgeons, form your own opinion, because everybody is different. I know it sounds cliche, but it's not. Like, everybody is different. You're going to heal different depending on if you have any other diagnosis that may cause you to heal slower than other people, depending on your skin type. So just do the research. And also the other thing is be patient. That's what I would tell everybody. My incision is still darker than what I would like for it to be. However, I was told to get creams, bio oil, silicone, biotin, collagen. I still use all of it, and I know it's going to take time. It'll be a year, June 14th. And my skin is just one of those ones. It heals slower. Yeah, so my skin heals slower. So I knew that it was going to be a while before it completely lightens up. But I'm patient, just going along with the process. My scar is technically in an area they call the bikini area. Technically, I can cover it up with my underwear, my jeans. You can't see it underneath my clothing. So that means actually going and Google. No, they say don't Google. Most doctors tell you don't Google this. Yes, Google to find out what a DIEP flap procedure is. A lot of people, like I said, even surgeons or doctors or healthcare professional has never heard about the procedure before. Going into this, when I looked it up, I found out that this was a procedure that was covered under a healthcare act because of women who have bilateral mastectomies. You have that right to get the DIEP flap procedure. You can get tissue transfer, or you can choose to get breast implants. I chose not to do the breast implants because I feel like I had enough tissue to use. Why not use it? So, but like I said, the healing time is a lot harder on your body when you go through the DIEP flap procedure. So again, just be patient and it'll come. My pain level was great. I probably used pain medicine for about 3 days post-op. And after that, I was good. Because I always think about my daughter. So I just want to say thank you for giving me this opportunity to get that off my mind of having, what if this happens to me 10 years down the line? Or what if the same thing happened at my mom's age when she discovered she was 63 years old? But I know he has given me more time to be there for my daughter and to make sure that she's taken care of and has everything that she needs going forward in the future. So thank you. So I did not have cancer. I just tested positive for BRCA1, which is a gene that predisposes you to breast cancer, ovarian cancer. There are some other cancers possibly, like pancreatic cancer, that you could get because of this gene mutation. When my mama, when she was diagnosed, because she was actually diagnosed on my birthday, so it was really hard. Once we found out that she was BRCA1 positive, I made the decision to go ahead, and I already knew, like, I'm going to go ahead and get this done. I'm not going to wait. Again, I thought back about my daughter. It just kept going back to my daughter. Like, I want to be there for her. Ultimately, that's what I was like, I have to do this.